The way the procedure is done, the patient is brought to the operating room. They are actually awake, although we do give sedation and local anesthetic, so they're very comfortable while we're doing the procedure. And what we do is we look for the specific landmarks. So we look for the tailbone, and then we identify the bones by feeling through the skin. And then once we've located the area where we believe the appropriate nerve root is, we actually take a small electrical conduction needle and place it through the skin that's been anesthetized and down into the opening in the bone. And that then sits down right alongside the nerve. And then once that's in place, we test it electrically, and we take some x-ray pictures to make sure that we're in the right position. Once we're sure that we're in the correct placement, we exchange this needle for an electrode that has 4 small contact points on it. And that actually, again, goes through the bone and sits down right alongside the nerve. So the nerve would be coming out kind of down in this area. And that's what's going to give the electrical impulses to the nerve. The patient wears this for 1 to 2 weeks. It's connected to a little external wire that comes out of the skin. And the patient hooks it up to a small generator. It looks sort of like a pager. And they keep a diary for us about their symptoms. When they come back in 1 to 2 weeks, if it looks like they've had a good response and an improvement in their symptoms, then what we do is connect this lead to a small internal generator. So it's basically like a pacemaker battery. And this is put just under the skin, kind of in the lower part of the back, kind of above the hip.
Come in here.
It's very thin, and so for most patients, they really don't even feel it unless they're pressing on it. And then this has a small set of computer chips in it that allows the patient to program the device and adjust it based on their symptoms.